couple things that you want to consider when you're dealing with avians is that you want to always have a low KVP setting and a high MA setting. So as you can see here, I already have it set to 62 for KVP and 8 for MA. This seems to work best for your smaller birds. A grid isn't normally used here when you're dealing with avians. And another thing that you can possibly use would be plexiglass, okay? In order to place the bird on the plexiglass, you can go ahead and take them into place. If you're going to do that, however, you want to make sure you adjust the KVP between 2 and 4 for the exposure factor. Another thing that you really want to consider as well when you're dealing with avians is that you don't normally use the calipers for measurements in order to get your factors. What you do is that you get your exposure factors based on the species and the size of the patient. The main reason why you want to have a low KVP and a high MA setting is that, particularly because of the bones and the structure of an avian, the birds tend to have thin cortices and tubular bones, and also the long bones have less calcium and less ossification as compared to mammals and reptiles. So that means that they are more radiolucent than your mammals and your reptiles when you're taking radiographs. There are 3 kinds of positionings that you want to consider as well. When dealing with birds, you have manual, physical, and chemical restraint. Your manual restraint is basically when you're going to be using lead apron gloves, right, like this right here, and then you're basically just going to hold the patient and go ahead and take the view. Then you have your physical restraint methods. You can use the gloves here, but the main things that you normally use are radiolucent adhesive tape, such as this right here, or if you have like sandbags or gauze or rope gauze and those kinds of things there. You have your chemical restraint, and your chemical restraint is normally the best route to take because you're only using injectable sedatives or otherwise inhalants that will knock the patient out for a short period of time, so you can go ahead and position the patient the way you want it to be. We normally use isoflurane here for that because the main problem with manual and physical restraint is that it can lead to stress to the bird, possible injury, and the worst case scenario, even death. 3 views that we always want to give when we're taking a radiograph of an avian patient. Fortunately, I don't have anything live with us today, so I'm actually going to be using a little stuffed goose right here. So we're going to go ahead and focus on the whole body ventral dorsal view, the whole body lateral view, and also the wing caudocranial view. So first we're going to do the VD view. So what you want to do is position the collimator as small as possible here because you want to reduce the amount of scatter radiation when you're taking the radiograph. So we're going to pretend that he's actually like sedate or whatnot, but in the VD view, you want to make sure that the sternum is superimposed over the spine. The wings are extended laterally like this, okay? And if you are awake, per se, first thing we want to do is actually hold the neck and feet, okay? Then you're going to go ahead and tape the wings like this. And a couple options that you have, you can use some manual restraint here, per se. So basically you would have your thumb and forefinger like this, and then you're basically extending the legs caudally, and then you would take the shot. Another thing that you can do once you have the wings positioned here, be careful not to damage their trachea or airway. You can go ahead and tape the neck like this, or tape the head, and also you would go ahead and tape the feet like this. So that's what it is for a VD view. So now we're going to go ahead and focus on the lateral view. You always want the patient in a right lateral view. The reason being is that so it'll be easier for the doctor to compare references, such as like in books or on VIN or something like that, because normally everybody always does the lateral view or right lateral view when it comes to avians. So once again, you would place the patient in lateral right here. All right. You would go ahead and take the neck here. You would position the wings like this. You want to make sure that the down wing, or the one that's on the immediate surface right here, is cranial to this wing right up here. So once you have that in position, you would go ahead and take both wings together right here. And then the same thing with the feet, you want to make sure that they are extended ventrally from the body. And then the same thing here, you want to make sure that the bottom foot is cranial to the other foot right here. Get a wing view. The position is normally used for this, so basically you're holding the bird upside down so that the body is perpendicular to the table. You then want to take the tip of the wing, feathers, and hold that and extend that away from the body, with the cranial edge of the wing being placed. So this is a cranial edge right here. You want to make sure that is placed directly on the cassette while the head normally hangs over. And then you go ahead and position that view like this. Once again, go ahead and pollinate that there. And then you would go ahead and take your shot.